Hi, I'm Dr. Alvarez with Endobariatric.com, and welcome to our frequently asked questions section. And today I want to talk to you a little bit about an email I got from one of my patients where she was asking me, how much can my stomach hold? And the question was coming from a standpoint that she was just a few weeks out, and she was able to drink more than 4 to 6 ounces at a time, and she was concerned. Well, is this correct? Is my stomach okay? Was my surgery done correctly? And today I'm here to explain a little bit about that subject, if it's your case, to put your mind at ease. That number one, the sleeve is designed for once you eat, for solids, once you sit down to eat. It's not designed to work the way it should. The first few phases, the diet phases, clear liquids, full liquids, so on and so forth, when you're going through the liquids, because liquids, guess what? Liquids go down through the sleeve. And they're supposed to do that, and that's why everything has a reason. That's why we give you, or we put you on a liquid diet after surgery, to make it easy on the sleeve so the liquids can go and flow through, and your sleeve will heal correctly, which is what we want. So first of all, don't get concerned. Remember that fluids will run through the sleeve, that the sleeve is designed once you eat, once the sleeve heals, and once you start eating, then it should kickstart the restriction. You should feel that restriction that we're looking at. Today I'm going to demonstrate on a little model I brought from my friends from the, even has the tag still, from the Brazilian Society of Bariatric Surgery and Metabolic Surgery. And when we do a sleeve, and we are left with that's why it's called a sleeve, because it's a long, narrow tube. It's a tube. So imagine yourself, if we cut here and you can look through here, well, it is a tube. It is a tube. And if you have a pitcher of water and you pour it here, it's going to run through. This is the last portion of your sleeve. This is the pylorus valve that stays intact at the time of surgery. We don't touch that. The intestine stays untouched in this surgery. So this is the way you're left, and when you pour liquids here, it will run through. Now the pylorus valve may put a little bit of restriction on the way it flows, but it flows. So liquids will run through the sleeve. So when you notice that after about day 3, day 4, as the swollen tissue from the sleeve starts to come down, you're able to intake more at a time, don't email your doctor and say something's wrong with your sleeve. No. It's intended to be that way. That's why you're on liquids. And the sleeve, remember, it's designed, once you start eating, this will fill up with solid food, and it will trigger the signal to your brain that you're full with solid food. Now, depending on how fast that swollen tissue comes down, it may be sooner when you feel that you're able to intake more at a time. Some people may feel it right away after surgery, 48 hours, 72 hours, really quick. Some people will feel restriction even to the fluid, to the liquid after surgery, and after about 5-7 days, it goes away, and then they feel the water run through, and that's what we want. And then we jump to full liquids for 2 more weeks, and then we start eating. So remember, patience, patience, patience. The sleeve is designed for solid foods. Be patient and go with the guidelines. If you have any questions, you can always contact your doctor. My patients have my direct email. I hope you find this useful. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.